we are a Christian fellowship. We believe the Bible to be the inspired Word of God, and that's what we base all our teachings on. And it's good to be able to extend our service, as it were, our Christian service to the community on something as topical as mental health tonight. I'm going to introduce you to David Haynes in a moment, who's just flown in from Adelaide to put the presentation on for you. However, we are coming across this topic quite a lot in our time. In fact, I've just got a magazine here from the Weekend Australian only a week ago, and we publish all sorts of things about mental health, anxiety, stress, and those sort of difficulties that people encounter in their lives. This particular article, which is titled Into the Woods, is just a story of 30 men, ordinary, everyday guys, in their middle ages, and going off into the bush to find themselves and some meaning and purpose to their life. And so it's everyday people looking for everyday meaning to life and where it's all going to take us. And this search for some sort of meaning and purpose and some sort of peace of mind about it all is what's causing, or according to some of the write-ups we read, a lot of the anxiety and the stress that we read about. It is something that, as we've been going through the streets of Balwyn and other suburbs in this area, people acknowledge that this is something that should be addressed, something that it affects a lot of people's lives, and of course when it affects someone's life, it affects the people that they have to relate to, and so it has a big impact. So we pray that you have an open mind tonight. David's presentation obviously goes through his experiences with mental health, and he's very experienced. He's a team leader for mental health and a consultant for mental health that works out of the Flinders Medical Centre in Adelaide. Very, very busy place. The emergency department for mental health there is extremely busy, and David is part of all of that. So he has an enormous amount of experience in the practicalities of dealing with mental health issues. But the wonderful thing is that, and I've known David for a long time now, since the late 80s, David also believes the Bible to be the inspired Word of God. He is a Christian, of course. We'll say a bit more about that later. And so he's able to apply his experience and his first-hand knowledge of mental health issues together with he knows and understands from the Bible teachings how real peace is achieved. So I'm going to ask David to come up now. Make him welcome. He's just flown in. So thanks, David. And we'll just hand over to David now. The presentation will be about 1 hour or so.
G'day everyone. Those of you that do know me know that I don't talk a lot normally, which my wife criticises me a lot for. She criticises me more though when I get in on a stage with a microphone in front of me, because she says I won't shut up. So I'm going to do something which I don't normally do, is talk a lot. I'll probably use up my whole week's worth of words in the next hour. I'll go home without any words left. I'm going to tell you a little bit about what I do for a job, and a little bit about my perspective on mental illness, and also a little bit about, a lot about, hopefully, where God fits in all of this. So as Pastor Roland said, I work in the Flinders Medical Centre. I'll tell you a little bit about that in a sec. But I got a phone call. I've known Pastor Roland about 30 years, and he rang up and he said, "Dave, we want to do a presentation on mental health." He said, "Do you know a mental health expert? I said, yeah, I do know one. And I've got proof. So back in 2011, Sunday morning, I turned up at work at 7 o'clock. So many police cars out the front of the emergency department. I thought it was going to be a big day. As soon as I walk inside, all the nurses ambushed me and said, David, we need you to see this guy. He's just murdered someone. We want you to come and do an assessment. The police want to see someone to see him. And I said, look, it'll wait till 9 o'clock. The psychiatrist can come and do it. They said, no, we want to do it now. We want to get this guy out of here. But yeah, right. So went and saw this guy. He just murdered his ex-girlfriend's father, just around the corner from where I live, next suburb. And so I had a bit of a chat to him and did an assessment and sent him to a better place, which was the police cells. And that was on the Sunday. On the Monday, the next day, on the front page of the Advertiser, there was a story about the incident on the front page of the paper. And you can't read that there, but in the blue bit, it says, it is understood that the alleged killer was assessed by a mental health expert again following the arrest. I thought, there we go, front page in the paper, I've got some credibility now, and I tell my workmates that I'm the expert. All right, so this is where I work. Flinders Medical Centre Emergency Department. It's the busiest emergency department in Australia in terms of the number of people that come in per day. So if you look there, about 2010-11, there were 61,000 presentations in that year. This year we're tracking for 90,000. So you can see the amount of, that's overall, that's not mental health, that's everything. So you can see how much that's increased. So we're tracking, we're sort of the busiest emergency department. And the photo there, that's a phenomenon we call in Adelaide ramping, where all the ambulances are stuck on the ramp and can't empty their patients because the hospital's full. Mental health patients are about 5 or 6% of the presenting problem, but for a lot of people, they present for something, but mental health is a secondary problem. So we end up seeing quite a few people a day, at least 10 people a day, but often more. My job is as a consultant. I'm a nurse. I'm a nurse, but I coordinate the mental health team. So I have a psychiatrist and a couple of junior doctors, a couple of students, a social worker, a couple of nurses in my team. And so we consult to the emergency department. Emergency department doctors are not very good at doing mental health stuff, and so they want us to come in and solve all their problems for them. So we do assessments, we teach the emergency department doctors and nurses and things about mental health, and we try to get people out of the emergency department as quickly as possible. That's my job. I also do a little bit of other stuff. I teach at Flinders University, teach paramedic students about mental health, and I'm writing a book for them at the moment on how paramedics should approach mental health. And I do a few other things as well, which keeps me busy. Hang on, something's happened here, and that wasn't me. It's not the computer. There we go. Back. No? Just hold it there for the next hour. Okay, so a lot of people ask me, well, what sort of people do you see that come in the emergency department? I want to have a guess what the most common presentation is for me for mental health side of things. Anyone have a guess? Call it out.
Anxiety.
Drugs? Yeah, I'm not a drug and alcohol nurse. It's just kind of a sideline for me. Anxiety? Yeah. What else? Suicide. I see a lot of suicide attempts and things. Yeah, what else? Yeah, I see a lot of depressed people. I see some angry people. Sometimes that's not a mental illness, though. It's just angry people. All right, most common presentation. All right, now, You might think that's a bit strange, but there was actually one last week. No, this is not every day. A few times a year, I'll see someone whose cat has died, and they come to the emergency department feeling suicidal. So there was one last week, early in the week as well, 2 or 3 times a year. Now, it's not the cat died that they're in hospital for, but it sounds a bit bizarre. Your cat dies, you end up in the emergency department, you're talking to me. It doesn't make sense. But for a lot of the people that I see, it's something that's tipped them over the edge. All right? So they were hanging in there and they were struggling, they were just coping and they were trying to do what they could do. And then something happens and bang, they've fallen over. And they're in the emergency department talking to me. It doesn't make sense that your cat dies and you end up in the ED, but there's all this other stuff behind that we then discover, we unpack. All right, so just my rough numbers, very, very rough. So less than 40% of the people that I see actually have a major mental illness like schizophrenia or depression or bipolar disorder. More than probably 60% of people that don't actually have a mental illness as such, but they might get a diagnosis of something, but really it's some sort of social crisis or emotional crisis or stress. Excuse me. We call it situational crisis sometimes, or adjustment disorder. So that's a big percentage of my work, is people that aren't actually mentally ill. A lot of people are intoxicated. I try not to see the intoxicated ones, but I get sort of sucked into it. Adelaide's got a lot of methamphetamines. I don't know what it's like over here, but Adelaide's got a huge methamphetamines problem. And it used to be, interesting enough, when methamphetamines first hit the front page of the papers to say there was an epidemic, we did some rough figures. Now when I look at the people that I see, if I looked at all the people that had drug-related problems, either they had too much drugs, not enough drugs because they were withdrawing, drugs and got in a fight, drugs and beat up the girlfriend, drugs and crashed the car, anything relating to any sort of drug, methamphetamines, cocaine, heroin, marijuana, anything. If I put all of those people in a pile, and then I got all the people that were related to alcohol, so either got drunk and fell over, cracked their head open, drunk and crashed a car, my husband got drunk and he beat me up, I couldn't afford alcohol, and so I was going into alcohol withdrawal. All of those people, put them into one pile. The alcohol pile outnumbered all the other drugs put together pile by 10 to 1. So we say we've got a methamphetamine problem. Actually, we've got an alcohol problem in our society. But of recent years, the amphetamine group is catching up. There's a lot more methamphetamine problem that's coming into the emergency department. That doesn't mean the alcohol numbers have decreased at all, though. Every day we're seeing alcohol-related problems. All right, how do we fix mental illness? These are the main ways. From a psychiatry point of view, from a medical point of view, these are the things we do. We use medication, we use psychotherapy, psychological therapy, counselling approaches, all right? We use other specialist things like ECT, electroconvulsive therapy, shock treatment. All right, we do some things like that. We play with people's brains. And we do social support. They're the mainstays of treatment for mental illness from a medical point of view. The question is, are we successful in treating mental illness? I'm going to go through a couple of stats here, just very quick. I hope I don't bore you to death with some stats, but it's very quick. 2007, there was a big survey, national survey of mental health and wellbeing. It's the biggest survey we've done in Australia through the ABS, and these are the figures that they've come up with. They're the most accurate figures we've got. It says at the time that 1 in 5 Australian adults experience mental illness in any 1 year. 1 in 5. So what I want to do is look at the 2 people sitting on your left and look at the 2 people sitting on your right. And if they look normal, then look, it might be you. I won't point any fingers, but I know who you are. These are the stats that they've come up with. It's quite a lot. All right. Almost half the population experience a mental illness in their lifetime. Intentional self-harm or suicide was ranked the 10th leading cause of deaths in Australia in 2008, but it's a leading cause of death for all Australians aged in that 15 to 44 age bracket, the leading cause of death. A lot of people die by suicide. And here's some numbers. These are the official numbers from ABS. Look at 2008, and then you look at 2017. Can you see a pattern happening here? All right, numbers are going up. Worldwide, there's approximately 800,000 suicides a year. That's about 1 every 8 seconds. So if you think about all of the deaths in a year from murder, homicide, and deaths in war or conflicts, you look at all of those deaths and you put them together, suicides outnumber that. All right, more deaths than homicide and war combined. So it's a lot of people die. And it says that depression is now the second worst global burden of disease for women and the third worst for the whole population. What that means, if we take how much money depression costs us, Australia, and you think about the cost of medication, the cost of going to a doctor, the cost of going to a specialist, the cost of getting admitted to hospital and all the treatments, the cost due to lost time off of work, all of anything, the lost productivity, that sort of thing. All of that cost, and we look at the global burden, the cost, depression on its own, not the other mental illness, just depression, it's the third highest expense out of all healthcare for Australia. That's a lot of money we're talking about. So are we successful in fixing mental illness? And is the rate of mental illness increasing or decreasing? Now, I work for a health system and I work with psychiatrists and I work with a whole lot of people. We kind of think we're pretty good at what we do. Sometimes we brag about how good we are about what we do, and we're always developing new things over the years, even in my short career. They're developing new medications, they're developing new approaches to therapy, they're developing new ways of playing with your brains with magnets and electricity and different things, trying to fix things. And we say we're really clever, we're really good at it. But is the rate of mental illness increasing or decreasing in our society? Certainly those stats before, the rate of suicide is increasing. So are we good at fixing mental illness? Well, you've got to question how good we are, how clever we really are. Probably not very clever. And then you see things like this in the paper the other day. This was only a couple of days ago, 24 October. They're talking about doing a royal commission in Melbourne into the mental health service. Why would they spend millions of dollars doing a royal commission into the state of the mental health service? It's only because it's not working. The system and the treatments we're providing is not working, and we're spending millions and millions of dollars and we're going backwards. So I think this itself proves that what we're doing is not working. I just want to introduce just briefly my new psychiatrist hero, Jock McLaren. I was at Cairns a couple of weeks ago for a conference, and Dr. McLaren was one of the speakers there. Said some really interesting things about psychiatry, and I could talk about it all night. There's a couple of the books he's writing. This one is just about to publish. He talks about the biocognitive model, and here you can't really see, but the biological psychiatry, the biological model. Psychiatrists are big on this is the model, and there's a big influence on the biology of mental illness. Most psychiatrists follow some sort of biological model. So just in simple terms, you would have heard people say, you've got a chemical imbalance in your brain. All right, so we're talking about a biological thing happening in your brain. And they'll say, you've got a chemical imbalance in your brain, therefore you need this chemical to fix it. What this guy says is here how biological psychiatry got it wrong. He's saying we are barking up the wrong tree. This is what he said at this conference the other day. He said, people say mental disorder is a brain disorder. People say it's a biological disorder. He said it's unproven. We do not have one bit of proof to say that mental illness is a biological illness. You don't hear that very... Dr. McLaren doesn't have a lot of friends as psychiatrists. He's a bit of a loner. Right. He also said something. Hang on. He also said, psychiatric treatment is relatively ineffective. This is coming from a psychiatrist. The medications we use, the zapping, electricity and magnets we use, it's ineffective. Drug companies tell you how effective it is, but he says actually it's not. And the evidence actually proves it's not. So, this was in the ABC a couple of days ago. Pain isn't just physical. Why people use painkillers for emotional relief. This is a really interesting article, if anyone saw it. It's probably still, you probably still find it. It was only a couple of days ago. Now, you don't have to read all this. It's in the middle that says emotional aspirin. So if you go back to the 50s, tranquilizers were an attempt by doctors to get people to feel better. They were using tranquilizers. I remember as a little kid, Beck's pills. And it used to say, take one a day. I think they've disappeared a long time ago. But in the 50s, they started using tranquilizers. In the 60s, they started using other things like amphetamines. Drug companies actually invented amphetamines as a pick-me-up, make you feel a bit better. Then they developed things like Valium. Valium, used to be called Mother's Little Helper. Right? It'll get you through the day. It'll make you feel better. Sort of in the 70s, so we're using Valium. In the 80s, we saw a new sort of medication that was coming in. It was called Prozac. It was one of their new style antidepressants. We call it Lovan, a lot in Australia. But they're one of what they call the SSRIs, the selective serotonin reuptake inhibitors. So it plays with the serotonin levels in your brain, supposedly. And all of this continually, this culture from medicine was saying, hey, take this pill, it will make you feel better. And it became one of the social norms. It became socially acceptable. I see people writing some notes there. I'm quite happy to email these slides to you, so you don't have to write notes if you don't want to. This was in the ABC website back in February. Another story. Jonathan Hari is a journalist from the UK. He wrote this second book that he wrote. And this story in the ABC says, more than brain chemistry, is society, not just serotonin, contributing to the increasing rates of depression? So he asked the question. He gives his story about when he was 18 years old and he was feeling depressed, and he went to the doctor, and the doctor said, you've got a chemical imbalance in your brain. Here, take this chemical, it will make you feel better. And so he did. He said, for about a week, I started to feel better. And then after that, I didn't feel so good anymore. He went back to the doctor, and the doctor said, oh, maybe take 2 of these tablets. So for a couple of weeks, he felt better. And then he started to not feel better anymore. And 10 years later, he's not only still depressed and anxious, but he's fat as well. Right? And he said, this is not working. Anyway, eventually he started to question a lot of what was happening and the treatment he was getting. That's a Prozac pill, by the way. Now, in this story, they interview a guy named Pat McGorry. You know Pat McGorry? He was Australian of the Year a few years ago. He was Professor of Psychiatry. And they asked Dr. McGorry, what do you think about this book? He said some really interesting things, did Dr. McGorry. Right? Hang on. He says, if you look in the middle there, it's not solving the problem for most people. It's not lifting most people out of not feeling good, which is why we need to have a much deeper conversation about why we're feeling so bad, why these reasons have been increasing, and we need to expand the menu of options so that we can deal with these deeper problems. This comes from Pat McGorry. All right? It's not working. We need to take a new look at it. And just quickly, this is the UK guidelines on depression, which we follow a lot of the UK stuff. And they looked at the evidence of depression, where it comes from and how we treat it. They could only come up with a couple of things that they were absolutely sure about. They said it's somehow linked to gender and it's somehow linked to social and economic factors. That's all they could come up with, right? Now, when it comes to gender, I don't think that's a biological thing. I think it's more to do with the role of the different genders in the same way as it linked to social and economic. So there's a strong link, for example, between depression and middle-aged, well-off women, right, tend to have high rates of depression. All right, so there's a gender issue, there's a social and there's an economic issue wrapped up with that. That's all they could come up with. Is the most extensive sort of guideline in psychiatry. All right, so I'm going to just change the topic a little bit. What is health and what is mental health? So I don't even have a clock, so I don't even know how long I'm going to talk for, so I'm just going to keep going. What is health and what is mental health? So we looked at the World Health Organization. They're often quoted. They say health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. All right, so you still can have a disease, but you can still be healthy. And a good example of that, many of you know Ben Campbell, right? I had lunch with Ben yesterday and he says hello to everyone. Ben's got diabetes, type 1 diabetes. Yet he's one of the healthiest guys I know. He'd just done a 3-hour bike ride that morning before he came over to my place. And I thought, you know, you can still have a disease, but be healthy, because we're talking about physical, we're talking about social and mental well-being. That's how they define health. So if we look at the World Health Organization, what is mental health? They say it's defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. That's how they define mental health. So you still could have schizophrenia, for example, and have a good state of health. If you're realising your personal potential, you're coping with your normal everyday stresses, maybe you're working productively in some area, and you're making a contribution to your society or your community. Right? These things are what we need to show that we're mentally healthy. I'm going to come back to that one. But look at the middle one there, can cope with the normal stresses of life. That's the people that I see in the emergency department. That's the thing that we capture a lot. They're not coping with the normal stresses of life. And an example I was saying earlier today was the guy I saw on the weekend, he'd had a marriage breakdown. It's going to be a stressful event. But 1 week after his marriage breakdown, he went to the GP and the GP said, "Ooh, you look depressed, you better take this tablet," and put him on an antidepressant. Now for me, that was wrong, because when you go through a marriage breakdown, imagine, I've never been through, but imagine you going through a marriage breakdown, you're going to feel depressed. That's actually normal. Right? But the GP says, "Oh, that means you're sick. You better take this tablet to fix the serotonin levels in your brain." Doesn't make sense to me. Don't read this. But on the World Health Organization, they talk a lot about the social determinants of health. All right? So here's an easier explanation. The circumstances in which people are born, grow up, live and work, and the systems that are in place to deal with illness. This comes from Nicholas Proctor, who's a friend of mine, who's a professor of nursing in Adelaide, and known Nicholas for a long time. He wrote this book. And I think it's a really important thing to understand about the social determinants of health. We're going to relate this to mental health as well. just as an explanation, social determinants of health. I mean, the World Health Organization talk about it a lot. For example, one of the main social determinants of health is fresh water. If you live in a place that has clean, fresh water, you've got a much better chance of being healthy compared to a place that doesn't have clean, fresh, drinkable water. You're going to be sick. So one of the main social determinants of health for us is access to water. We could talk about access to healthcare. We could talk about social networks, all sorts of different things that contribute to our well-being. Nicholas broke it down to 4 factors. I'm just going to look at 2 factors here, individual and community. So individual, the ability to manage feelings, thoughts and life in general. Emotional resilience and the ability to deal with stress. So as an individual, they're things that we need to stay healthy, particularly mentally healthy. Nicholas is a mental health nurse. So these are the things as an individual we need to stay healthy. And as a community, or in our community, we need social supports, a sense of belonging, and an opportunity to actively participate in a community. So these are the things that we need on a community level to stay healthy. We need supports, a sense of belonging, and being able to participate, which kind of aligns a lot with what the World Health Organization was saying as well. All right. Now, Nicholas invited me to a lecture a couple of years ago, and one of the speakers was a chap from the Red Cross, International Red Cross. And it was really, really interesting what he said. Now, there's a guy who I think is from Melbourne, but his job was in disaster relief. And so what he had to do was, if there was a big disaster somewhere, like an earthquake or a tsunami or a bushfire or something, and the Red Cross was going in, his job was to be the first person in. So as soon as something happened, he's on a plane, he's there, he sets up the base, and then he pulls in everything else that he needs. So he'd been around the world and looked at disasters around the world. He said something really interesting. He said, if you're in a disaster, if there's an earthquake or something happens, you're in a disaster, what's the thing that's going to set you apart? What's the thing that you're going to need that's going to help you to live more than any other thing? The thing that's going to set you apart. If you want to live through this disaster, what's the thing that you need? You don't want to have a guess what that thing is, the most important thing to have in a disaster. Come on, call out. Hope? Hope? Well, that's a good one. It would help.